The COVID-19 pandemic could be good news in the fight to curb the spread of tuberculosis. Dr. Helen Marie van der Westhuizen from Oxford University says the pandemic has allowed those with TB to wear masks without being stigmatized. So let's discuss this further with her. Very good morning to you. Tell us about what you've seen now as far as those who suffer from TB are concerned.
Yeah, thanks, Jane, and thank you for the chance to have a discussion. So we have been using masks to prevent the spread of TB for several years now. And as a doctor myself, I trained in South Africa. And when I offered a patient a mask who was just diagnosed with TB, they would often be very hesitant to wear it. Especially in South Africa, masks was previously strongly associated with having the disease tuberculosis. And then, of course, 2020 came along, our masks became part of our everyday lives, and all of a sudden it's not as stigmatizing to be seen wearing a mask in a clinic or on a taxi on the way to the healthcare facility. And so this has really helped patients who need to wear masks to prevent TB from spreading. I think a second component is also important. So previously we've been giving masks to patients who we know have TB. So once you're diagnosed, you receive the masks and you're asked to wear it in communal spaces and maybe during your visit to the healthcare facility. But we know that around 50% of people who have tuberculosis don't know they have the disease yet, and they may be asymptomatic and still spreading it to other people. But previously, because we've been only focused on people who we know have TB, we've not used masks to prevent TB in those people who are asymptomatic, where it is still a valuable preventative tool. And so now with COVID, we are all wearing masks when we're sitting on the taxi, when we're visiting the healthcare facility. And so it has become a common practice, and it has become much easier to use and to wear in public.
And do you think that this will help people with TB wear it once the pandemic leaves us, if it ever does? I mean, do you think it'll help making that conversation a lot easier, a lot more understanding?
I think so, Jane, absolutely. And I think there's also an opportunity for us to ask, how do we want to continue using masks in the future? And I realize that our impulse is to say, please stop, we are tired of these cloths that we have to put around our faces. But if it can help us to prevent suffering caused by COVID, but also suffering caused by TB, it is a valuable preventative tool. We should have that discussion. And so my suggestion would be that we stop only focusing with using masks to prevent the spread of TB. Stop only focusing on people who we know have TB, but rather identify the spaces where people are at risk to spread TB to others. And those spaces are also spaces where COVID spreads more easily. So it's in enclosed spaces like a taxi, or if you're waiting in the queue at a health facility and the windows are all closed, those are all high-risk spaces. So I think if we can have discussions to negotiate where are the hotspots where both COVID and TB is spreading, and if we manage to end this COVID pandemic and we stuck with TB still, where are the places where continued use of masks will still be a valuable tool? The suffering caused by TB is no different to the suffering caused by COVID.
All right. I mean, I guess people forget about those living with HIV, living with TB, unless it's constantly kept up there as a reminder in the fight against the pandemic. I mean, where are we? What is the status when it comes to fighting TB, and how many people have it in this country?
Yeah, so for many years, TB has been the leading cause of death. For 2020, I think it will be pretty close between TB and COVID. So I think it would be very dangerous to take our eye off the TB pandemic. There was a national TB prevalence survey that was done in 2019 that some of the preliminary results have started to trickle through, and the results have been very worrying. The TB pandemic is much bigger than we initially thought in South Africa. A larger proportion of people in that data set had TB but didn't have symptoms, so we only picked it up when they did x-rays to see who has TB. So it really should get a lot more attention than what it currently does. I think the problem is with COVID, the timeline is so rapid. So you get exposed to someone who is infectious and within the first 2 weeks, if you will become symptomatic, you might start to show symptoms. With TB, the timescales are much longer. So say, for example, I take the taxi today, I sit next to someone who is ill with TB, I get exposed. It may take weeks, months, sometimes even years before I start developing TB symptoms. It doesn't mean that TB isn't deadly. It just means that that sort of chain of transmission takes much longer. And I think for us as society and researchers, we have to take up the challenge and say, just because TB spreads slowly doesn't mean that we have to be slow in our TB response. It is still causing an enormous amount of suffering, and we need to do something about it. I think COVID has shown us what is possible. I think all of the investment into a vaccine. With TB, we are using a vaccine that is 100 years old. It doesn't work very well. It only helps in children and helps to protect them from very severe disease. So we are trying to fight a deadly TB pandemic with outdated tools, not a lot of investment in new research and new development. And yeah, our response has been slow. Our data, I think COVID has shown us what accurate, up-to-date data can do to help us target public health interventions where the hotspots are.
Okay, Helen Marie,
we don't have that kind of data.
Sorry, we're going to have to leave it there. Fascinating, and thanks for reminding us how important this is, how dangerous and how united we all are at the moment having to wear a mask.